Thank you all for joining me today to learn about this Skills2Care certification course for occupational therapy professionals. What is Skills2Care? Skills2Care is an evidence-based program developed by researchers at Thomas Jefferson University in Philadelphia that was designed to help family caregivers manage daily challenges more effectively. The Dementia Collaborative offers certification training for occupational therapists. Why OTs? Occupational therapists are ideally suited to teach caregivers how to set up and modify daily routines and activities, use effective strategies, and handle difficult behaviors. Skills2Care is a proven home program that improves well-being and skills of family caregivers, slows decline in daily functioning of people with dementia, and reduces challenging behaviors that can trigger nursing home placement. Occupational therapists trained and certified in Skills2Care provide hands-on education to families to enhance their ability to manage day-to-day challenges and take care of themselves. Care strategies are developed and implemented that are tailored to the unique needs and environments of families. Program content. Occupational therapists certified in Skills2Care teach caregivers how to manage those day-to-day challenges of dementia. The program content includes helping caregivers understand dementia and disease process, reduce challenging behaviors, promote the function of the individual with dementia, communicate more effectively, make the home safer, and gives caregivers ways to care for themselves while providing the best care possible. Payment and reimbursement. So Skills2Care as a standalone program is a caregiver program, meaning it can be offered as a private pay consultation service. However, Skills2Care can also be integrated into our patient's plan of care in order to receive reimbursement through Medicare Part A and B. I myself actually have a practice called Day by Day Home Therapy, in which we integrate Skills2Care into our patients' Medicare Part B or outpatient insurance benefits. Skills2Care can also be provided through aging service networks supported by the National Family Caregiving Program. We see that many times people do find grant funding to help support this implementation. Certification requirements. So there are kind of three core parts of certification. That includes the online modules. These are self-paced, and completed independently prior to the live day one of Zoom. These typically are able to be accessed about 1 to 2 weeks prior to day one of training. Then there's the live online Zoom instruction and practice. This is 2 live Zoom days with me. We participate in learning about this implementation of Skills2Care while also doing some role play and practice of the program. We have live online coaching sessions that take place after these 2 full live Zoom days. The coaching sessions are 1 hour each, 5 sessions. I sometimes schedule 6 so that you have the opportunity to miss one if needed. And these are spread out over 6 months. This really is to help support clinicians as they translate what they learned in the course into the real world. It's also necessary for learners to deliver Skills2Care to at least 3 to 5 caregivers to receive their certification. And they actually do present a case report and submit all of the Skills2Care documentation during their coaching calls. So you'll actually do a case presentation during a coaching call. In the event that you are feeling hesitant to get Skills2Care certified because you don't know if you'll be able to identify those caregivers, I'm working actively right now to create a list of people in the community who would benefit from Skills2Care. However, their family member does not have Medicare and they can't afford to pay privately. So we're happy to match these clients who are looking for either pro bono or discounted services to learners, occupational therapists who are in the training process of Skills2Care. Please feel free to email me if you're hesitant about Skills2Care certification because you don't know if you'll be able to find those caregivers. Keep in mind that while Skills2Care can be delivered as a consultation during training. It can also be directly integrated into patient's plan of care. So many clinicians will start treating clients using the Skills2Care program integrated into that patient's plan of care as soon as they complete their live Zoom days, and that is perfectly okay as well. Skills2Care certification is a bit lengthy. It takes place usually over the course of 6 months to account for those coaching calls. However, at the end of it, occupational therapists receive 30 contact hours. Initial certification is good for 2 years with the option for renewal at the end of it. Continuing education. The Dementia Collaborative is an AOTA approved provider of professional development. We do have a course approval number for 3.0 CEUs. The disclaimer is that the assignment of these AOTA CEUs does not imply endorsement of this specific course content. The instructional methods, this course utilizes a variety of instructional methods that includes web-based videos, readings, live Zoom courses, written assessment, case presentation, group work, role play, and discussion. I already mentioned this, but again, there's the self-paced online modules. Those take place usually 1 to 2 weeks prior to our first live Zoom day. Then we spend 2 live Zoom days together. Those, of course, can be done from anywhere as long as you have access to Zoom audio and video. And then we have our online coaching sessions. Those can take place via Zoom or phone. Learning objectives. I won't read each of these during this video. However, you can feel free to either pause this video and read through these, or they are also available on the Dementia Collaborative website. There are specific learning objectives for self-paced online modules, for the live online instruction and practice, and for the live online coaching sessions. In terms of training location, times, and dates, please refer to the Dementia Collaborative website for the most up-to-date Skills2Care certification dates. Day 1 and 2 are live Zoom calls. So unfortunately, people ask me often if they could just listen to a recording. We do require active involvement from learners, so you will be required to be live on those Zoom calls. We typically start those live Zoom calls at 10 a.m. Eastern time, and that is to attempt to accommodate multiple time zones. Coaching calls are typically scheduled on Fridays, and the trainer does consider group time zones upon scheduling. Training and certification fee schedule. Again, please refer to the Dementia Collaborative website for the most up-to-date information about Skills2Care certification fees. Group discounts are available, and the fee does include access to Jefferson Elder Care's Skills2Care website with documentation forms for as long as that certification is active. Here is the evidence that supports the Skills2Care program. The Administration on Aging and Rosalind Carter Institute recognized Skills2Care as an evidence-based program delivered through aging service networks. Research to develop and test Skills2Care has been supported by funds from the Administration on Aging, Alzheimer's Association, National Institutes of Health, Pennsylvania Department of Health, Tobacco Settlement, Farber Family Foundation, and the Rosalind Carter Johnson & Johnson Initiative. Policies and disclosures. There's a speaker disclosure, there's a cancellation policy, ADA needs that we're happy to accommodate as long as we are contacted at least 2 weeks prior to the event. Skills2Care is a trademark of TJU, and the Dementia Collaborative LLC is an authorized licensee and trainer of the Jefferson Skills2Care program. Frequently asked questions. I'm often asked if certified occupational assistants can become certified. The answer to that question is yes, as long as they attend certification with a supervising OT. There are a variety of components of Skills2Care that do require assessment, so that is why we require an occupational therapist to also be certified along with an assistant. Again, sometimes I'm asked if people can watch a recording. Unfortunately, we really do require active involvement from our learners. Typically, our groups are capped at 14 people max, so we have a nice, small, intimate group of learners, and we really do require you to attend. How can I find other Skills2Care certified OTs? I'm so glad you asked. If you go to the Dementia Collaborative website, there's a tab for find a certified Skills2Care certified OT. You can type in your zip code and find out if there are any actively certified OTs near you. I'm also asked if Skills2Care is appropriate for new grads, or is it appropriate for people who have been practicing for quite some time? I mean, I am Skills2Care's biggest cheerleader, so I am a fan of Skills2Care regardless of how long you've been practicing. I do think that there are benefits for most groups of people, regardless of your experience level. And I say that because Skills2Care, again, it's an evidence-based program for caregivers. So it's possible to have really in-depth knowledge of dementia care. And this is really a structure in which you can deliver the education and knowledge that you have. However, if you are a novice and you don't know too much about dementia care, this is, I think, a nice starting point to have the structure to build your skills. So I do think that there's potential that it can benefit people with limited experience and those with a lot of experience. Again, I'm happy to talk to anyone one-on-one about your particular level of experience or your potential hesitation for getting certified. I realize that this is both a time commitment and a financial investment, and I want to make sure that anyone who attends certification is happy with their decision and it's the right fit for them. So please feel free to contact me via email, and I'd be more than happy to answer your questions. Here's my contact information, the dementiacollaborative.com. dementiacollaborative.com. Either one should bring you to our website. And you can email me at info@dementiacollaborative.com. Thank you all so much for joining me today, and hopefully I'll see some of you in the Skills2Care certification course.